Oral motor activities are so important because the oral motor movements are determining kind of some of those textures that your child can eat. So your child might not eat a carrot, maybe not because they don't like the color. It's not even about the color or the taste. They can't physically chew it. They don't have enough strength to chew it off and take a bite off their molars. Some of our kids bite in the front, and you see the kids and they just bite everything right here. A lot of our kids take things and they pocket it. So you'll find food later on in the day still in their mouth because they just never cleared it. You have to be able to actually use your tongue to clear out the sides of your cheeks. So you might get things stuck in your teeth. They just don't have the ability to get them out. So they just hang out there. Or you see a lot of our kids who do this, and they're moving the food actually with their mouth into the right position. So some of our kids put their hands all the way in their mouth to try to get the food in the right place. Or you have kids who overstuff. And what they're doing is they're moving food to move the other food back. So you have a lot of kids who they look like they're eating, but what they're doing is they're putting in a blueberry and they're going, not one chew. And I've seen this a lot. And then families are like, well, you see this a lot with corn, often with babies, right? Babies eat corn and the corn comes out completely whole. Well, this happens to some of our kids who are older and some of our adults who cannot chew. So I know one of the questions was about how do you help with chewing? And so there's a variety of different ways that you can help with chewing. Some of these activities here are even just working on lateralization of the tongue. So you can see up here with the lollipop, what they're working on is getting your tongue from one side to the other side. Why is that even important? Because when we eat, we're moving with our tongue and we're able to clear on different sides. If you get food on your lip, are you able to get it? Or are you groping? If you're groping to get food, when you open your mouth, the rest of the food goes out. So a lot of our kids look like messy eaters and we don't give them that food, or you're constantly taking a spoon and we're fixing it. Right? So what a pleasurable experience you feel when all of a sudden it's like scrape, 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 bite, scrape, scrape, scrape. So then our kids don't want it. And you're like, you used to love yogurt. Well, I don't love yogurt when someone's touching my face every single time I take a bite of yogurt. Get that yogurt away from me. So these are the things to be mindful. That's why that sensory play is so important, being able to be messy, because no one enjoys those things happening to your face when you are trying to work on them. We do use a variety of approaches, such as Beckman, the Beckman Oral Motor Program, and that can help us to target the musculature around the cheeks and the mouth. It takes so much to be able to chew. So like Highland said, we are chewing in a rotary movement, but not even just that. You have to coordinate your mouth, your tongue. You have to get the food in the right place. You have to take the food. You have to be able to know when you're too tired on this side of your mouth, I need to lateralize the food, which means I need to move the food from this side of my molars to the middle of my tongue over to the other side. And I need to do that safely so it doesn't go to the back of my throat and I choke on it. If you find that your kid is coughing a lot during eating, if they cough after they drink, if later on all of a sudden they're choking, like maybe that food is getting stuck somewhere, or they weren't able to chew it in the right way, or they chewed and a little piece got stuck back there. And so chewing is so complicated. It is really tricky. So these are just some of the ways that we do work on it. One of my favorite activities working on tongue movement is you have to make sure your child is safe in this. So it is really important to always speak with your pediatrician, make sure there is no aspiration happening. Aspiration is when food goes down into our lungs. That can cause pneumonia. So if your child is getting sick frequently, if they have colds frequently, if they're snoring a lot, those are all signs. Like, go to your pediatrician and make sure nothing else is happening. But one of my favorite activities is taking a Cheerio and taking the Cheerio and putting it on the tongue. And then you move the Cheerio with your tongue to your back molar. And then you can work on the other side. It's really fun to do with your child. So again, with feeding therapy, you're doing these things with your child. It's not, okay, take this Cheerio, now put it from your tongue and move it to the other side. That is actually why we have seen that telehealth has worked so fantastic during this time period. During COVID, in the center, we are wearing masks. We cannot eat with the kids right now. It is really hard to show someone what to do with your mouth when you can't see your mouth. So we're learning different ways. We're opening our mouth. We're showing them with our tongues and different ways. But telehealth is fantastic because you can see my mouth very clearly. I am right there in front of you right now. So these are the things you want to think about when you're playing with the food, or when you are working with the food. You're doing the same things as your child. That makes it really powerful. Imitation is the greatest thing to help your child start to learn. So then we can also learn on or work on blowing bubbles. Blowing bubbles really helps you to kind of build that strength and that ability to move your lips, to make your lips round. To drink from a cup, you don't think how important it is to have all of that lip strength and to be able to cup your lips and move your lips around it, and to go from a big cup to a little cup. So that is something that I know both Angela and Shayna work on a ton with OT, is finding the right cup to help you sip from. Sometimes we use little teddy bear squeezes to help with the pressure, because it's really hard to suck up with a straw and suck up this materials. And then if you think about water, water is really tricky. Water moves all over. It might go into my mouth, and water is really tricky because it's so thin that it can move backwards really quickly. So some of our kids, when they first start drinking, they start coughing right away because that water, right back to the lungs. And so Angela actually has a really cool tip in this one. So I'm going to let her share that because she's fantastic. So Angela, want to pop in?
Sure. So much shared love in this group. I appreciate it, team. The only addition I've made to this fantastic slide that Nikki's put together is working on some oral motor skills specifically to the movement of our lips. Nikki just mentioned how important our lips closing around a straw or closing onto a cup, or when you're eating from a fork, your lips help clear the fork and not just relying on your teeth. And so a lot of our clients that we see have difficulty with the coordination of their lips. And so one activity I like to play with our kiddos that can safely eat this particular food is use things like a licorice rope or something that's a little bit longer. And so our challenge during our therapy meal is to see if we can be able to eat the licorice rope only using our lips. And so what we have to do is bite the licorice and then advance the licorice with our lips. So we're working on the really small muscles of the cheeks. We're stabilizing the jaw. And then we're also working really much on the lip closure and coordination. And a lot of kids want to use their hands, but it's a really fun competition, especially for our older kiddos that might have some weakness in their oral musculature. And so I like to play this particular game as a competition. See who can do it very quickly, or the fastest, or do the biggest pull into their mouth from the licorice. Certainly this is also, we've said this a lot, but I'll mention again, it's important to make sure that your child is safe to eat this particular food, as licorice ropes are a little bit more challenging to eat, and certainly encouraging quick eating also needs to be made sure that that's been deemed safe by your therapist. But that's one game that I added. So thank you.
Yeah. And something to add really quickly too is if your child does have difficulties with this chewing, you do want to seek out help. It does not matter how old they are. We can help them and help you. So often telehealth is to watch to make sure that we can help you within the home setting too. Sometimes what we will do too is you can do frozen French toast. So it's something that is soft. It's easy to eat, but if it's frozen, you have a little bit more ability to keep it in your mouth to chew. You just want to be very, very careful what you work on to chew, because if they cannot handle it, that is when a choking hazard happens. So it is always important to seek outside help. But there are things and textures that you can play around with that are safe. And then the lip ties and tongue ties, they do affect feeding therapy, not just speech therapy, but they affect the feeding. So often when we get a tongue tie or a lip tie, we're like, oh, I wonder how they're eating. And we often see that first because a lot of our babies, when they're itty bitty babies, they have a lot of reflux. They cannot take the milk down. There's a lot of air that goes back with it too. And with those oral ties, there's often anterior and there's also posterior. So you might not even see the tongue tie, but you see this little indent and it looks like a heart. And depending on pediatricians that you go to, some people are a lot more likely to remediate it, and some people are a lot more hesitant. So it really just depends on who you go to. If you find that in your gut, you're like, oof, there is something here, it doesn't mean that you don't have to stay with that pediatrician. You might need to seek elsewhere. There are a lot of pediatricians in San Diego who are hesitant, and there are a lot who are Fantastic. Now, that doesn't mean if you have a tongue tie, go get it cut. It is function. So you're looking at the function and you're looking to see what your child does, or your young adult. A lot of us have them and we just make it do. And we've learned how to compensate. You just don't eat the chewing, or you don't eat the chewing. You don't chew different foods and you avoid different foods. A lot of dentition can cause difficulty with chewing. My brother, who is 30 years old, has a severe underbite. He chews steak differently and he gets heartburn from it. And I know exactly what's happening. He's not going to get his dentition fixed at this point because that takes him out for so long and he can't afford to do that. But he has to compensate by having smaller bites and putting them back, and his jaw gets tired more quickly. That doesn't mean he can't eat foods, but knowing what happens can help you see why this is happening with your young adult or with your child.